All right, guys. Well, listen, if there are questions, you don't be shy, pipe up, ask your questions as I go along. I've only got 10 slides, so it's not going to take that long. And just want to share my screen with you. So today we're going to talk about, well, there we go. I obviously hit the wrong, can you see that? Or maybe I hit the wrong presentation mode. There we go. Good. So Steve Crane wanted me to talk about sun and skin health. And so that's the topic today. And, for you lifeguards, you're really focused on saving people who are in distress in the water, saving them from drowning. But I think when you think about it, you can probably do as much good protecting people from harm from the sun. So what do I mean by that? This cartoon is about a couple that have come down to the beach, and they're walking on the sand. They feel the warm sand, and they feel the warmth of the sun, and they can see the beauty around them. And this is from light and warmth from the sun. What else are they being exposed to from the sun? Heat. Yes. Thank you, someone. Yeah. Electromagnetic radiation. Because remember, the sun is a giant nuclear reactor. It's just one short astronomical unit away from us, unshielded. And so it is spitting out all these waves, radio waves, visible light, which you can see the colors of, and then ultraviolet, just above visible light, gamma rays, and X-rays. And we're going to pay particular attention to the ultraviolet radiation, although X-rays and gamma rays are also involved in skin health. Now, you've probably heard about it from your physics classes, ultraviolet or UV, streaming down from the sun and coming to Earth. Now, what protection do we have from ultraviolet? Ozone layer. This is very important because ozone blocks a part of the ultraviolet, not all of it. As you can see, some of the UV rays get through, others are blocked. You can also see from this, if you imagine the sun over at an angle, like you would imagine in the morning or the late afternoon, the UV has to come at an angle, and it goes through a longer path through ozone and through clouds, so there's more blocking of the UV. And by contrast, in the middle of the day, from 10 o'clock in the morning till 2 in the afternoon, it's coming almost straight down. And so the path through the ozone is shorter, and there's less blocking going on. So your UV index goes way up in the middle of the day. Just something to keep in mind. Now, I'm not going to spend too much time on this, but this is cool. This is a listing that scientists put together of all the various cancers that we deal with at a cancer center. The names are shown on the x-axis, and on the y-axis is the number of genetic mutations in those cancers. Now, genetic mutations are alterations in the DNA code, and the cancer that has the highest number of genetic mutations of all the cancers we deal with is melanoma. And it's partially blocked, but over here on the lower right is a description of the types of mutations. And we know that the mutations in melanoma are almost all very characteristic thymidine dimers. Now, what's important about that? That's the characteristic damage that ultraviolet causes. So this is the proof, the scientific proof that ultraviolet is the cause for the mutations that lead to melanoma. It's also true for other types of skin cancers, including basal cell cancers and, to a lesser extent, squamous cell cancers. So a little bit of science. I know you guys got through with your classwork and want to forget about all that maybe for the summer, but this is the background to show you the importance of ultraviolet causing skin cancer. Now, what are melanomas? What do they look like? You may have seen them, you may not have, but because of your role as a lifeguard, you're going to see a lot of people down at the beach club. You're going to have an opportunity to look at your own skin, look at your fellow lifeguard's skin, and other visitors. And so you should pay attention. If you see something that looks like one of these spots on the skin, that probably needs to be checked out. There's a little rule of thumb that we use called the ABCDE rule. And A is for asymmetry. So if you see a spot on the skin that's darkly pigmented but is irregular in shape, not symmetrical, that could be a melanoma. B is border irregularity, and I think you can see the notched border here. C is color variegation. See the dark pigment here, and then the red here and the pink here. If you see that, that's another sign it could be melanoma. D is diameter. So if it's bigger than putting a pencil eraser on it, then it's a higher risk of being a melanoma. And lastly, E, evolution. If a mole or a pigmented spot on the skin changes, this probably needs to be evaluated by a physician and possibly removed. There's one last one. The English actually add an I to their little rule of thumb, and that's itching. If a mole or abnormal lesion like this itches, it probably increases the likelihood that that could be melanoma. Let's just look at a couple of other examples. Here's a melanoma on the face. You can see the border irregularity. Here, the color variegation is showing up. This is a nodular melanoma. These are dangerous because they grow internally faster than spreading out on the surface. Another nodular melanoma, and you can see the variegation, the color variegation. Another melanoma, and yet another. Here's one on the finger. Now, why are these skin cancers that important? Melanoma of the different types of skin cancers has a nasty tendency of spreading. So this is a artist diagram of the skin, a cross section of the skin, and you can see to the left a thin melanoma, and then to the right deeper melanomas that are penetrating down into the layers of the skin. If something is not recognized early, the melanoma can grow deeper, and the abnormal cells can gain access to the blood vessels in the skin, and then little clusters of these melanoma cells break off, get into the bloodstream, and they can go into organs inside. And that's when, unfortunately, I have to see them at the cancer center. But it's obviously much better to detect melanoma early, have it removed by the doctor, and this spreading it will not happen. Now, I mentioned some other types of skin cancers. Melanoma is important because of its propensity for spread, but other cancers are also a major nuisance and problem. These are basal cell cancers. My wife tells me, she's a dermatologist, she says these are often misdiagnosed as a pimple that won't go away. Or squamous cell cancers, two types of squamous cell cancers in this patient. Now, the thing about basal cell and squamous cell cancers, they can be a major nuisance on the surface of the skin, but fortunately, they don't spread internally very often. Okay, so what are the risk factors for developing a skin cancer? Well, skin that easily sunburns. Now, I'm looking at all the lifeguards here, and I can't detect anybody with particularly fair complexion, but you all can see yourselves. And if you have a particularly fair complexion, particularly red hair, there's less pigment in your skin, so less protection from ultraviolet. So that would be a risk factor. Also, the amount of sun exposure in your lifetime is a risk factor. So we have to take steps to minimize that UV exposure. The use of tanning beds. Now, tanning beds is a euphemism. That's a nice sounding word, makes you think of a nice warm bed, but it's actually an ultraviolet radiation machine. And from what based on what I've told you, who would want to pay money to get into an ultraviolet radiation machine? Think about it. Not good for your health. Um, freckles. This does increase the risk of skin cancer because it means you have a skin that's more prone to this. Family history of skin cancer. If that's in your background, you have to factor that into your risk. Or so, what does the CDC recommend to keep you safe from skin cancer? Reduce your exposure to sunlight. And we know that we're talking about ultraviolet here. And I threw in, especially from 10 a.m. to 2 p.m. So this is, I know it's very hard to implement at a Laurelhurst Beach Club, but if you can encourage in your management of the club people to stay under shade in the middle of the day when the UV flux is maximal, then everybody will be, their skin will be happier. The other thing to keep in mind is that these risk factors for skin cancer are linked to ultraviolet exposure from childhood up through early adolescence. It's hard to believe, but by age 15, the die is cast. The genetic events that we talked about in the skin have already happened at that point. And that leads to genetic instability and cancers that happen later on in one's life. So it is super important that you all watch the munchkins that are down there at the beach club and encourage parents to think about appropriate clothing, hats, UV blocking tops or bottoms, especially for the youngsters, or staying under the shade of that beautiful tree that as you come into the beach club, it's a wonderful spot in the middle of the day when the UV is the maximum. Wear a hat and protective clothing. Now, you guys are down there patrolling the dock. I hope you're wearing a broad-brimmed hat. This is really essential. You know what is happening in Australia, where the ozone hole has prevented blocking ultraviolet. Skin cancer is rampant there, and people that work on the beach, lifeguards and the like, are all wearing broad-brimmed hats to protect themselves. Wear sunglasses because UV can also damage the lens or the retina, the back of the eye. Use sunscreen. Now, you know, there are two types of sunscreen. There's the physical block sunscreen with zinc or titanium, that reflects away ultraviolet. And then there are the chemical ones where the chemical absorbs the UV. But just remember, these are only partially effective. They require a lot of the compound on your skin. You have to apply a pretty thick coating, and you have to reapply because there's nothing that's really sweat resistant or waterproof. We've already mentioned ultraviolet radiation machines and frequent skin examination. So take a look at your own skin, look at it in the mirror in the bathroom, and if you see something that looks suspicious, anything like the pictures that I showed you, ask your doctor. And now this is my last slide, and for you art lovers, who painted this? Anybody know their French Impressionist art? Claude Monet. And this is Monet's wife and little son in 1880s in France. And, you know, I love this painting, but look at the way they were dressed. And the parasol that Madame Monet had. And the little boy with his little pit helmet on. Now, you'd look pretty silly walking around Laurelhurst with clothing like this, but we have modern versions that will do the same thing, that will block UV and keep you safe in the sun. So I don't know, I see people on my screen. If you have any questions, I'd be happy to take any questions, but I really appreciate your paying attention to my talk. Thank you.
Thanks, John. Does anyone have questions?
I just have a question. Like,
Yes.
how are we supposed to implement or like tell or encourage people to like wear like extra like clothing or stuff, especially when people are swimming all the time? And also like a lot of people just don't want to because they're just trying to get tan, and I feel like they wouldn't really listen. So I'm just curious how.
That's an excellent question. That's really the root of the problem that you've hit the nail on the head there. I think it's education. If you're aware, if you're sun aware, and you understand all the electromagnetic radiation that's coming from the sun, you're going to change your own behavior. You're going to be a role model. You're going to wear the right kind of clothing yourself, and you're going to encourage, especially youngsters and their parents. It's the middle of the day. Let's think about having some shade and then going back out. Run out, get wet, cool off in the water, and then come back and dry off in the shade, as opposed to baking out there.
Okay, got
I
it.
mean, it's a trade-off. I admit. We don't want to be paranoid about going outside. We all enjoy summertime. Seattleites save up for the beauty of our summers. And we want people to like the beach club and enjoy their time there. But you can go down and have a great time and come away with 100 units of UV, or you can go down there and come back with 500 units of UV exposure. And what's the difference? Well, it's a little bit of smarter behavior, one way versus the other.
Okay, thank you.
You're welcome. Thank you. Good question.
Is there a particular level of UV, like not dangerous, is dangerous? 6, 7, 5, 2?
Well, the UV index is in the newspaper. If you read the newspapers, it's in the weather report. And I don't know the exact numbers to quote you, but we know that it's present even on overcast days. As you get dense clouds, you're going to get very little UV because it's blocked. But if you have light clouds like we have oftentimes in summer in Seattle, there's still UV. We also know that UV is higher the higher the altitude. So this is not a beach club talk, but if you guys like skiing or going to the mountains in the winter, super high UV on the mountains. But we're fortunately at sea level, so we're getting some protection from our atmosphere and ozone. Remember, the peak, if I could draw it with a graph, the UV is down here low at sunup, spikes way up high, and then comes back down in the afternoon. So just be aware of that difference.
Oh. Sorry, John, you kind of cut out sort of towards the end there. The last thing I heard was it comes down in the afternoon.
Yeah, I'm sorry. Yes, that was my internet has an unstable personality, but it's just that, just being aware of the I don't know what the shape of the curve is. It's a bell-shaped curve, except it's very peaked in the middle of the day. And just be aware of that relative intensity of UV in the middle of the day.
Do you
Well,
have
I'd like to think.
I have one more question, John. Sorry.
Yes, go ahead.
So you walk into Bartell's, there are about 1,000 different suntan lotion options, or just sunscreen options. Is there an SPF that you recommend? Can we application every hour, 2 hours, 30 minutes? Do you have any guidance there?
Exactly. I personally like the physical blocks, the titanium and the zinc ones. They make some that are emulsified now that don't make you look like just pantomime whiteface, I think that you want to get the highest SPF you can. They all cost about the same, so you might as well go for SPF 70 if you can, because it's going to be more effective. And apply every, 2 to 4 hours. Depends on how much you're in the water or how much you're sweating, what the temperature is, because these will eventually come off, but frequent reapplications will make them work better. I do like clothing, hats, and UV protective shirts even better than sunblock. But if you don't want to wear those kinds of clothing items, the sunblock will help.
I have a question.
Yes.
So since we are lifeguarding on a lake, what's the best sunscreen like that's best for the environment? Because like how it all like gets in the water and stuff, like like it kind of like rubs off quick. So we want to like have
Well, that's a
something
wonderful question.
effective for
And yikes, I don't know the answer to that. I would have to look that up. But that is an outstanding question. We should think about that because you can see the sheen in the water when you get in as it's coming off your body. That's something that's a research project for all of us to look up on Google after we're done with this. Thank you.
Any other questions from anybody? All right. Well, thanks again so much, Dr. Thompson. Really, really appreciate you taking the time to help us with this morning. I know from the perspective of a guard and just someone who works down at the club that, that's one of the best parts about, having the summer job is that you're in the sun all the time. But I mean, just, listening to this presentation, the risk is real. It's there. And I think it's important to educate. And it's a tough thing to police. I think ultimately it comes down to everyone's personal decision, and especially the members down at the club. It's not our job to walk around and start scolding 7, 8-year-olds, next to their parents. But I think the best thing that we can do is just lead by example. I mean, and for
Yes.
our own health and for the health of others. So this was, I think, really beneficial. So I really appreciate you taking the time.
Thank you, Cody. Thank you, everyone. Have a great day.
Yep.
Appreciate it.
Thank you.
All right.
Thank you.
Thank
You bet.
you.
Bye-bye.
Thank you.